Good afternoon, everybody. Welcome to this meeting in public of the Shropshire, Telford and Wrekin ICB. Just to remind everyone, this is an unscheduled meeting in a sense because it was intended that we would be spending the whole of the afternoon as a board development session, but there's some urgent business we need to transact. Hence the formality of the first part of the meeting, after which some of us will move into the board development session. A couple of housekeeping announcements. Alison Smith has told me, she didn't ask me, she told me to tell you to speak into the microphone because some of the recording was unclear at the last meeting and therefore it makes it more difficult in terms of taking minutes, etc. So if you could do that. The other thing is the ladies' facilities on this floor are out of order. There is a disabled loo on this floor that people can use, or there is a ladies upstairs. I think I've fulfilled the housekeeping announcements, have I? Thank you very much indeed. So, some introductions, if I may. First of all, Richard Nuttall. We've become accustomed to seeing Terry G at these meetings since our inception, Richard. He's moved on to great things and you've taken his stead. Richard, welcome. Would you like to just introduce yourself?
Yes, hello everybody. My name's Richard Nuttall. I am joint chair of the Telford and Wrekin Chief Officers Group, COG. So I'll be taking up, sitting here instead of Terry G. I'm also chief executive of a charity called the Shropshire Support Trust as well.
Good to see you.
Thank you.
Good to see you. I also want to introduce Simon Fogel. Simon? I think this is your first meeting. I think it's your first meeting because I wasn't at the last meeting, but you're very welcome. You are the new chief executive of Telford and Wrekin Health Watch, is that right?
That's correct.
And sat next to you, is it Ali Sangster-Wall?
Yeah,
here
that's
representing Lynn Corley. I don't think you've been to one of these meetings previously.
I haven't, no.
Again, you're very welcome also. Good to see you. I also want to make another introduction, if I may. Gemma Smith, who is sitting in the back benches there. Gemma joins us as Director of Strategic Commissioning actually next week, but is here as part of an induction to the meeting. We look forward to you working with us. Welcome. She's a refugee from Staffordshire. I mean that in the best sense of the word. She's served her time and now she's come to a system without any challenges at all. So good to see you. Good to see you. I have a number of apologies. Nitty Paul, Sean Davis, Pauline Gibson, Jackie Jeffrey, Harry Turner and Meredith Vivian are the ones that I know about. If I've missed anybody, I apologise and we'll add subsequent. Thank you very much indeed. We'll note Cecilia's apologies as well.
Neil and Councillor Andy Burford.
Councillor Andy Burford. Are there any other calls for apologies? Sorry? Kathy Pert. Are there any more apologies? Let's draw a line there. If there are any more, we'll add them subsequently. Moving on. Apologies for absence I've now covered. In terms of introductory remarks, well, just a couple of things really. It's an extraordinarily busy time of year, not least of all because of the pressures upon the services for which we have responsibility. And again, continuing admiration and thanks from me for all that everybody is doing to keep services moving forward, not least of all during troubled times of industrial action from junior doctors and from nurses. Who knows where the industrial action will lead? We'll just have to keep an eye on that. But the contingency plans that we put in place seem to have held together pretty well. But let's be clear, for those who are not taking industrial action, those who continue to run services, it must be increasingly wearing and if not wearing, then certainly exhausting. And we're very grateful to everybody for the things that they do. The next, I suppose, introductory remark I just want to make is that the long-awaited Hewitt review, Patricia Hewitt's review of ICBs that was commissioned by the Chancellor, has now landed. The last minutes of this meeting, which I wasn't able to attend, said it was imminent, it arrived. The government hasn't responded to it yet, but I understand they will be in the not too distant future. Quite what it means for ICBs is not entirely clear. There's some really positive and strong messages in there. But the strong point that comes across, I think, is about the importance of cultural change, behavioural change between NHSE, regional officers and ICBs, and within ICBs and partner members of ICBs. Lots of practical things like reducing the numbers of targets and related issues. I suggest that when we see the government's response, we find a way of having a discussion about it around this table in some way, shape or form, unless anybody this afternoon has any burning issues or points of contention they wish to raise about it. Let me then just ask you to attest or otherwise that the minutes of the previous meeting represent a true or correct record. I think there's one issue, Simon, that you wanted to draw to our attention.
There's a point of clarity been raised in terms of the musculoskeletal conversation, and I've agreed to go back and look at the recording of that and just bring back to the future board meeting to make sure that that's an accurate representation of the conversation and the agreements that the board took.
Okay. Everybody happy with that? Any other points of accuracy, comments about the minutes? I wasn't there, so I can't attest to their veracity. Vice Chair, you happy with the minutes?
Yes.
Thank you very much.
Everybody was very kind to me, behaved themselves.
Well, I've heard such accolades about your chairing skills at that meeting. I'm thinking about taking more holidays during board time. But thank you, actually. I should have said at the start for managing the meeting extremely competently. I'm very grateful to you. Okay. Any other matters arising that people wish to raise? The next item then relates to questions from members of the public. As far as I know, we haven't had any. And I should have dealt with declarations of interest earlier. You know the drill. If there are any changes to the declaration of interest register, you're to notify us of them and they will be recorded. Have there been any, Alison, that you're aware of? No, thank you. Now, the principal reason for this meeting today was the need for us to talk about the operational plan for 1923-24, get an update, and also, because of the timelines associated with this, seek approval of the board for it moving forward to NHSE. And linked to that, there is the capital plan update, which we have circulated to us as well. I'm going to hand over to Simon, I think, just to kick off with an introduction to the operational plan and issues relating to that. Do you want to start from there?
So thank you, Chair. Can I just check you didn't want to do matters arising or any of the actions from the minutes? You're okay to?
Gosh. Thank you for reminding me. Are there any pressing ones from there that people want to allude to?
I think most of them we pick up, to be fair.
I thought we did. I thought we did.
Didn't mean to fragment the conversation. Apologies.
I don't think there are any others that we need to arise, to alight upon.
I'll carry on with the Chair.
Carry on.
Yeah,
Carry on.
Okay. So I'm going to hand to Claire and Julie shortly. The first bit, the Chair's already spoken about the recognition of the work that's going on in terms of delivery of services. I just want to reiterate that in terms of, at the same time as doing that, I absolutely recognise organisations are also then trying to do everything they can in terms of the planning, the finance, the operational piece, the sharing of information, and that pulls us in many different directions at similar times. The board will be aware we had a private session at the last meeting where we went through the submission at that point in time. That hadn't yet been through board conversations and hadn't been through conversations in terms of further NHSE and further iterations in terms of the numbers. So what you've got in public here is the iteration of the plan that has been submitted as part of the national submissions. At a headline level, and this is very headline level before I go to Claire and Julie in terms of putting some of the detail on, we are saying that from a finance position that we're going to still put forward a significant financial deficit across the system, but it's a financial deficit that providers and the ICB are working really hard towards. And I just want to be clear that there's a commitment to continue looking at that. Even though this paper is written at this point in time, there's further work happening around what those numbers actually are. So there's a reason that we're asking for delegated authority chairs, because when we make that final submission, we don't want to come back to the full board in terms of that unless we're deteriorating that position, but we want to make sure that the board's cited if we're going to improve that position. And then from an activity operational plan against the main targets of urgent emergency care, elective, mental health, children and young people, then in broad terms, and this is very broad terms, the system is absolutely being ambitious in saying it's predominantly aiming to meet the operational planning targets that exist for the residents of Shropshire, Telford and Wrekin. And that's based on really strong provider, commissioner, collaborative work, looking at what needs to happen and who delivers which services where, and how we really maximise on that focus of the potential of delivery within our system. So there is an ambitious operational plan that will absolutely demonstrate improvement this year, as in 23-24, in terms of delivery compared with the previous year, but with a confidence of the level of stretch in that, but an absolute commitment to get behind that and really drive the delivery of that. And then alongside that is a very honest and realistic conversation about the financial challenge that exists in our system, recognising that where we're exiting 22-23 at, and the improvement level that we want to drive for 23-24, we're not going to go to a break-even position in 1 year. We want to get into a multi-year improvement conversation. To get into that properly with NHS England will need us to have some credibility in the bank and some clarity on delivery on both our operational aspects and our financial aspects to enable us then to properly engage in a multi-year improvement plan that gets the system onto a sustainable footing going forwards. Clearly, the end point across all of this, recognising this is a 12-month operational plan, is get to a point where we're delivering on the operational targets for our residents, which means we're improving outcomes, and we're doing that within the finances that we get allocated to our system. We absolutely can't do that in isolation just as NHS organisations. We're absolutely cognizant of the challenges in our local authority partners. We're absolutely reliant on how do we work with the voluntary and community sector and how we work with residents and patients in our patch to enable us to make sure that we've got the right services in the right place to meet the needs of that population. It's tough and it's challenging, but it's absolutely the right commitment that we should give to our population and to the residents as we look forward into 23-24. At a headline level, that would be my introduction. Am I coming to Julie first or to Claire?
Happy to do Julie first.
And at this point, Julie, if you say I've covered everything.
You have actually, Simon. It was more, obviously, if the board had any more detailed questions. I think you've covered the changes since we spoke and what we've put in on the 30th, and still continue to. I think it's not necessarily we're not going to make any drastic change or anything other than obviously the continued work on the finance numbers. It's continuing to understand the risk associated with our ambition and looking to take as many actions as we possibly can to minimise that risk, or where we can't minimise it, then seek appropriate mitigation. So I think that's where we've kind of moved into that phase now, if that's okay. That's all I wanted to add.
Yeah. And a very similar brief addition from a finance perspective, very much aligned with what Julie's just said. We absolutely know that the figures that we're looking at here carry a significant amount of risk in terms of the finance position. So certainly from my perspective, the landed position then moves me into a conversation with colleagues around the system about how we either reduce the risk that we've got or have plans to mitigate it, because we're never going to be able to fully reduce it. Just to note the capital plan, because this is all tied in, that's been very quietly sitting in the background while we've been having challenging conversations about the revenue position. That hasn't changed at all since our very first submission. We have a compliant capital plan, very much based on the priorities of each of our NHS partners, in the core allocation for things like backlog maintenance, new equipment, IT, but also there are some plans that we have to utilise additional national money. We are obliged as a system to publish those capital plans, which we've done very recently, so they're there on our website to see, but it was just to flag it here to make sure we've got a governance route through to the board, but those plans haven't changed at all since the very first submission. I'm happy, as Julie, happy to take any comments or questions.
Thank you, Simon, and thank you, Julie and Claire. Are there any questions, any issues that people want to raise? I realise that this was subject of quite a bit of discussion at the last board meeting, and there have been intensive discussions between now and then between officers and others. This is a really ambitious plan. It covers all of the bases in terms of delivering on urgent and emergency care, delivering in terms of elective care, cancer care, and a host of other things. But nobody should imagine that it's not without risk. There are risks associated with it, and we're all focused and determined to manage those as best we possibly can. But it's a plan that requires our collective support, which I believe we have as an ICB, but it'd be helpful just to have people confirm that, unless there are reservations to the contrary that we need to hear about. Tina.
Around the workforce figures, which are quite ambitious, and I just wonder, has there been any sort of challenge to that? Where do we think that's going to land?
Fair question, and the numbers look eye-wateringly ambitious, but interestingly, I've challenged them as well. They are linked to very clear developments, and Simon, you might want to just explain, or Claire, what those links are.
Yeah, so I think several strands, Tina, as you'll know, from the risk for us is the national challenge is how can we grow our workforce when we're delivering such a financial deficit? And our challenge and honest conversation back is actually where that workforce is targeted, whether that be virtual wards, whether it be integrated discharge team, whether it be theatres and theatre capacity and activity, whether that be Shropcom, Robert Jones and Agnes Hunt, or whether it be recognising the progress that staff are making in terms of moving to a established staffing position from a challenge position in a number of areas, that actually we need to be able to demonstrate how that delivers a reduction in agency in the right way, but equally how those additional staff will deliver the capacity that we need to deliver on the operational plan, in which case then we improve the productivity piece in that space. So that's the triangulation of the conversation that we've moved into. I think the really important bit is the challenge for all of us, collective effort, of how do we recruit these individuals to fill those posts if we're saying that's what we're committing to, because to deliver that level of capacity, deliver that level of recruitment will be a step change compared to what's happened in previous years. But we need those staff to then to be able to deliver on the activity that we're saying we're going to deliver. So national team absolutely recognise that and are in a much more informed place because we've been able to articulate that position really clearly. So thank you to provider colleagues in terms of that provision of those bridges and that level of challenge that we've been in. We now need a real collective and combined effort to focus on that. And I know with Alex landing in the system, the revision of the people agenda and the people space is part of that work as well. Sorry.
Thank you very much indeed. Patricia.
Yeah, just in terms of assurance and comfort, particularly around the workforce numbers, to do with the virtual ward, which isn't a Shropcom piece, it's an ICS workforce. And we're doing more of this, aren't we, in terms of workforce numbers that we put in around the joint team. certainly in terms of assurance, we've seen far more interest and uptake in the virtual ward and rapid response teams because it's a new model of care, it's modern healthcare, and so our recruitment around that has been positive compared to other areas that aren't so attractive in terms of models, for example, community hospitals and so on. And so I think it's about the type of models of care that meet population need and how we articulate that together, and joint posts, which seem to be on testing that market far more attractive. That is not to say that we haven't got a huge workforce challenge, but it's moving towards those more attractive, integrated models of care that where we can provide people with a broad spectrum of skill and opportunities for skill development that we're seeing far more uptake.
Thank you. David, and then Roger.
Thank you, Chair. And it references Simon's introduction around risk, and I just wanted to socialise the Council's position, both Telford and Wrekin and also Shropshire. So 2.10 on page 30 references about the discharges improving, but other than Simon's commentary around risk, just to play in the risk associated with that comment, it is an ongoing financial liability for Telford and Wrekin of 5 million and 7 million for Shropshire Council, both of which are not funded, and it is both councils are unable to fund that investment to prop up the plan. Also in finance section 4, it doesn't reference the risk associated with those two numbers of 5 million and 7 million. However, I do accept that the financial element is NHS predominantly led, but reference in terms of text is a bare minimum. So I just want to be clear to the board that the risk associated with delivery of this plan is predicated on a sustainable position for both councils of 5 million and 7 million respectively. Thank you, Chair.
Thanks, David. Let me just take the points and then hand back to Simon, Julie and Claire for responses. Roger.
Yeah, it's very interesting to hear the comments made from David there and also from Simon about how we need to bring this together. At the moment, I think that the piece of text we have in front of us about the operational plan has huge gaps about joining up the various elements. So I think we need to demonstrate to our public and residents and patients how things will be joined up, because at the moment it isn't. At the moment we have our finance data in one place, we've got our workforce data in another place, and our activity data in another place. And what we need to do is to demonstrate the causation of effect of bringing in more people, what will that deliver, and how much is it going to cost. And at the moment, this paper doesn't give us that information. Now, it may well be in the minds of the executive, et cetera, but I think in terms of our accountability, we should be demonstrating that for this additional 572 posts, what are we going to get? And what are the risks around recruitment of that? Because at the moment, the expectations of delivering the activity from what I've seen here don't really bear out the reality and the risks of what we're trying to achieve. And I think we need to be honest about the risks of achieving the activity levels and the difficulties of recruitment. Otherwise, we're going to be down towards the end of this financial year questioning, where we've got to and all this. So I think we need to have an expression of the risk. Now, the Audit Committee met last week, and we have a concern from the Audit Committee around our risk assurance process and our board assurance framework. They're not ready yet. But again, this has to be put into an overall context of how we are managing risk as an ICB. And at the moment, I feel from the Audit Committee Chairman's perspective that we haven't really got there. We're starting, but we've got a lot further to go down the road of that. The other key element to this is the 235 posts in primary care. So we're putting a big investment into that area. But again, it's demonstrating what that will return to the population and patients. At the moment, that again isn't demonstrated. So I think in summary, I think we've got a lot of work to do to get assurance around the figures. I think we have to think through how we're going to present this to the public and explaining what we're doing as an ICB. And then the final point is coming back to capital. I felt the capital plan really lacked data on what additional output and activity we're going to get from the various capital investment schemes that we're investing in. And I think we need to address that as soon as we can. Thank you.
Thank you very much indeed, Roger. I see a red light over there. Is that Nick or Neil wanting to come in at this point? No? Actually, Neil, I did want to bring you in, actually, because there's a section, 213 refers to it, about the plan of mental health, learning disabilities and autism. All targets are planned to be met, except the elimination of inappropriate out-of-area placements. Did you want to add anything to that?
I think that's an accurate description, Neil. Where I think we'll come under greatest pressure is autism, but we're making good progress in key appointments, and that will make a huge difference. There are 3 consultant medical practitioners joining us in the next couple of months. We'll be able to galvanise teams around them, and I think that will make a huge difference. I think it'll be a much more complex issue looking at out-of-area placements simply because of bed capacity, complexity of patients, etc. So that's not going to be a quick fix, but it's something we're confident we can address. But the other issues I do feel confident around.
Thank you very much indeed. Any other comments before I hand back to Simon, Claire and Julie for any responses? So, Claire, maybe you could pick up the points that Roger made about risk assurance arrangements, etc. Observations from Audit Committee and I guess from other subcommittees as well. We're giving a lot of thought to the means for delivery and how we're going to really focus on delivery for the next the next few months or year or so and beyond. How did you want to respond to that particular point that Roger has raised?
It's something that we agreed to pick up through the committee, so we've done the preliminary work to scope the risk environment that we've got and the reporting that we need, but obviously risk extends beyond what you write on a piece of paper. It's about how we identify it and what we do in response to those items that are there. So I'm anticipating that Alison in the background is beavering away on next steps in terms of how we provide the right structure and information to facilitate the conversations. So obviously as individual statutory organisations we have our own risk management process and approach, and that will be a thread through all of our operational and committee discussions. What we're trying to do is find that sweet spot of how we find the best of that to then support our system conversations, because it's a slightly different lens we're looking through as a system as it is for the individual organisations. Thank you.
Again, Roger's point about how we describe, how we present the benefits, the outcomes, the benefits to populations and to individuals. Any thoughts, Simon, about how we should go about that? It's a really important point.
Yeah, so I think there's a couple of strands there, and I think it is a really important point. So there's the narrative submission that sits behind this as well, but again, you wouldn't necessarily say that was an easy read. But I do think we need something that builds on both the integration strategy, the work that's going on in terms of the JFP, that says for this year, how do these elements hang together? Because you're right, Roger, they do. And if you look at the priority areas in the capital plan linked to the additional capacity that's being brought online that will support the workforce, that requires the workforce increases to deliver, that then delivers the operational performance piece, there's a really clear line of sight. But if we're not making that easy, we need to get an easy to read narrative that shows how those bits join together. So I think that's a really good prompt, and I think we can pick that up, Julie and Harriet's here. We've started conversations already. Because I think that's a really fair point in terms of getting that landed in the right way. I think then, can I pick up David's point as well?
Please do, I want to come to that. Yeah.
The reason it's not mentioned in the finance section, David, is because you're right, because that's the NHS finance risk piece. However, you're right to highlight in the operational piece, and we're in the dialogue there, as you know. Look, there's no simple solution to this, but the work around the Better Care Fund review, the work around joint commissioning, the work around the adult social care money that is available, the money that the ICB is putting into that area, we've got to make sure that we maximise on every penny of that and we use that in the right way. I absolutely get the conversation about, are we starting from the right baseline in terms of the money that's going into the service in the first place? I think the reality we've got is significantly financially challenged local authorities, significantly financially challenged NHS organisations, NHS Commissioner, and as a result, we need to work fundamentally differently to drive this change. And that's beyond just talking about it now, because it's the here and now of the impact this will have on services. There's not an easy answer that I can sit here, Chair, and say, and the answer is this, but I will absolutely give the commitment to do the hard yards and do those difficult bits to say, how do we deliver some of this in a different way than we've done previously?
Thank you. Any other comments? Julie?
It was just to add, again, Roger's point about demonstrating the impact and how we're bringing all this together. And I wanted to say that as part of the planning process, I think probably more this year than we've ever done, we've maintained a really close triangulation between our activity, our finance and our workforce. And I think the piece that we are doing, that we said we just kind of needed to get a plan landed, and then there's the intention that all organisations have nominated a sort of productivity lead that we're going to bring together sort of the middle of the month to start to think about how do we demonstrate that. So as you say, yes, we've got the narrative that we've got things like our elective hubs with our 2 providers, our additional community services and what that means, but then how is that driving? How can we demonstrate what that's bringing for us? The elective hubs are relatively straightforward because we know from the business cases the expected activity, so we can track that. But I think the output of that productivity group that I know is going to be linked into Gava's Financial Improvement Board, I think will help, and it's almost like part of their terms of reference is to demonstrate that impact and to get underneath our productivity. Because I think what people don't realise, for example, we know because we've measured it quite carefully, that one of the consequences of the pandemic has been the patients waiting for longer is the complexity then when they are treated, and that's affecting our theatre efficiencies, etc. So we've got to work our way through that. What does that mean? What else can we do to drive those efficiencies? So I think all of that will be picked up through that group, and again, I'm sure we'll bring things back to the board to demonstrate our progress on that.
Thanks very much indeed, Julie. Any other points? Just a few sort of thoughts from me before I just remind us of what we're asked to do with this report. First thing to remember is that this is a system plan. It's not a plan that represents individual organisations. It's an integrated system plan. And I know that we get that, but we need to keep reminding ourselves of that. And therefore, we have to work much more closely together than ever in terms of its delivery. I think the points that we've heard about in terms of showing the benefits and demonstrating to ourselves and the public how these investments, these interventions are intended to improve services and improve care for patients is really important. And Simon, Julie, Claire, it'd be good to hear from you for the next meeting, actually, what exactly that looks like. I'm not suggesting that nothing should happen before then. If you've got things that you want to start telling people about, a narrative that's exciting, straightforward, but set out our ambitions, then I would encourage you to do that. The other thing that I think is missing, it's not missing, it's really important that this board has a really tight grip on delivery. So my request is that we have a paper or some discussion about delivery mechanisms for the next board meeting in June. Now, by then, we're nearly 3 months into the year, so we would sincerely hope that delivery is already happening, but let's actually have a look at that and assure ourselves as far as we can through our committee structure, etc., that those delivery mechanisms are fit for purpose. If we're honest, in the last financial year, the first year of the board, and we were only existed for the part year, and we inherited a whole panoply of delivery mechanisms. It wasn't joined up as we wanted it to be. So let's really focus on that for this new year. The other point that I just finally want to make is the local authority concern about resource and the implications for the 2 local authorities, but also the implications for the NHS in this plan. This is something that, again, as Simon has said, collectively we need to focus upon. Some of us have been having some start of discussions about this outside of this meeting and elsewhere. Let's really think carefully about what we can do to see how we can help improve that position. So I commend this plan to the board. It's ambitious. It's not quite in a form that the person in the street of Shropshire, Telford and Wrekin would readily understand and be able to see the benefits, but it's there, the material is there. Let's extract that and make sure that it comes across in a persuasive way. Let's also, excuse me, focus on the delivery mechanisms so that we're all clear about who's meant to be doing what, and so we can hold each other to account. And if I can just find the covering note, we are asked to note the final draft. We're asked to comment on the updated position, which I think we've done, comment on the proposed revised financial position, which you've had the opportunity to do. And we're asked for delegated authority to the Chair, the Chief Executive and the Chief Finance Officer to be able to sign off a finished version of this, a final version of this, for submission by midday on the 4th of May. Are you happy to accept those recommendations? Everybody okay with that? Thank you very much indeed. So, moving on then. Oh, and by the way, I'm taking it therefore that we note the capital plan update as well. Is there any particular approval you want from us for that, or is it just a question of noting it at this stage?
Just board support for the plan. Individual boards, again, will have seen their elements and signed it off.
Okay. So the next item, Associate Non-Executive Member of the ICB, Simon Whitehouse.
It has my name, but if okay with Alison, I'm going to come straight across to Alison.
Thank you, Chair. So hopefully the paper is self-explanatory. We are suggesting and proposing a creation of an associate non-executive member of the ICB to try and resolve some of the issues we have at Finance Committee at the moment, which I explained back at the November meeting when we were looking at recruiting a independent expert advisor for that committee. Unfortunately, that recruitment wasn't successful and we didn't attract the calibre of candidate that we were hoping. So we've had to review and rethink. We think actually that part of the issue here is that we're competing with NHS Trust colleagues in terms of trying to attract associate non-executive directors that they're recruiting across the country who don't have voting rights on a board, but they do attend and they do take a full part in the discussion, and that is part of succession normal succession planning for NHS Trusts. So we've been competing in that market, and I think that's probably one of the reasons we haven't attracted those people that we were hoping for. In order to create that, though, we need to change the constitution, and that's what this paper is proposing, that we add them on as participants. So they are non-voting, but they will attend the Part 1 and Part 2 board meetings and take part in the discussion. So I'm looking for approval from you as the board to go ahead with that change in the constitution. We will need to make a formal application to NHS England for that change to be ratified, but this is the first step in that process.
People happy with that? Trevor, did you want to comment on that?
No, I think from the finance point of view, we are starting to get the attendance of non-execs from some of the partner organisations at that, but it's quite a small group, and it's putting a lot of onus on a small group of people. And as we've heard, it's quite important that that committee works fairly well over the next year.
It certainly is, isn't it? Katrina, and then Patricia.
Okay. Moving forward, just out of interest, I mean, I speak to a lot of people who are in the non-executive space. On the whole, a lot of people are interested in associates, not necessarily full non-executive. They don't see the difference. They don't really rate having a vote as being something that is so special that they would prefer a non-exec role over an associate non-exec role. The one question I would have, and so I think that's quite a positive position, one question I would have is we're calling it a member, which for many non-executives would not make sense. So my question is there an opportunity to consider it as an associate non-executive director, as we do within the provider element of the NHS, because that may be a more, Simon's laughing, clearly I'm pressing a button, because that might be a more understandable stroke attractive consideration.
He's probably chuckling because I assume between him and Alison this is an issue that's been debated quite a bit in the past, has it?
No, we did have a conversation earlier this morning about this very thing. So technically, legally,
ICBs have members of their board, so the non-executive member is a member, not a director, as they would be legally in a trust. However, we have had a discussion this morning on that very point, that actually this could actually cause more confusion than resolve it, Patrice. So I think we probably will need to just revisit that, and if the board's happy for us to just rename that to allow that sort of comparison, I guess, between what people are seeing in a provider trust board configuration to something that's then recognisable in an ICB, I'm happy to do that.
And of course, our colleagues such as Trevor and Roger are non-executive directors, and it would also align with their colleagues on the board as well.
Yeah. Thank you.
I love a discussion about this kind of thing. Thank you, Katrina. Simon?
Sorry, I don't mean to extend it, Chair, but I think look, there's a challenge here in terms of a nationally determined constitution that uses the word member. I think for public facing, we should use the word director and just be consistent in terms of that. Whether we then need to change the whole constitution, I think is for debate, but let's just work with what works outwardly looking and work with what's legally expected inward would be my view.
Patricia?
Yeah, I mean, I get the point around associate NEDs. I agree. I think that the voting thing is a bit of a misnomer. I also get the bit about the sort of the succession planning. However, in the context of STW, which is hugely financially challenged and which running costs are over where it should be, is this something that is this going to push our running costs into further? That would be my only comment.
The running cost issue, Claire? Claire?
The value of the role has been in the plan now for the financial year that's just finished and is rolled forward into the underlying position as well. So it doesn't create an additional burden in terms of that underlying position. I think when you look at the value added from having that post in place, we will find a way of covering that within the position because we need to have that post. When you take the 23-24 plan, we know we've got quite a significant cost improvement programme within our running costs. That's to break them even, so that post is within there already, so we're already capturing that work. It doesn't make it any worse than it already is, Patricia, if that's the point you were just exploring.
You okay with that, Patricia? Well, probably not, but in terms of value, for the necessity for this post, are we comfortable with that explanation?
Yeah, albeit that given our financial position, we do need to consider, it may be pence compared to the gap, but nonetheless.
Yeah, it's 8k roughly against the running cost of around about 10 million. And it's covered off. And I mean, I must admit, having listened to lots of discussions about this over the last few weeks, the value, I think, is overwhelming, actually. So I'm strongly supportive of it. And what I found interesting, Alison, is for this single issue, you pull away at the Constitution, before you know it, you end up almost rewriting large parts of it. So let that be a lesson to us. If we want to change it, again, beware the bureaucracy that we have to go through. But I think this is the right thing to do. I take it from the discussion that people are supportive of it, so we'll move ahead on that basis. Good. Is there any other business? I've got one item that I wanted to raise, but is there anything else people wanted to raise? I just wanted to record and congratulate MPFT for its university designation. As Neil was telling some of us earlier, it's only taken 7 years.
And that's not the university's fault.
No.
Just to say.
I didn't think for one moment. It would be Vice Chancellor. But it's a great accolade. And on another occasion, Neil, you might want to describe the benefits to us all for that designation.
Well, thank you, Neil. The benefits are significant, and we've only been ready, perhaps, for assessment for the last 12 months. 6 years before that was the build-up. Thank you.
Yeah, well done. It's really good news. And again, it's testimony to the partnership between your organisation, the ICB, and Kiel. So Excellent, good news, good news. Is there any other business? Next meeting is the 28th of June, and we have 15 minutes to prepare for the development session. The development session, you might imagine a development session, we'd sit in round tables and we'd get into groups and so forth, but I'm reliably informed that logistically we can't change the format of this room, so you'll have to pretend this is one big round table, is what I'm told. We'll manage as best we can with this table layout, but thank you all very much indeed, and we look forward in just less than 15 minutes the development session. Thank you very much indeed.
Do you want those? Shall I do?